In this program, we will outline the appropriate steps and precautions for intubating dogs and cats. This is a necessary procedure to maintain an open airway in situations of reduced breathing capacity or upper airway obstruction. Two examples of such situations include unconsciousness due to anesthesia or head injury. This tube serves as a valuable secondary purpose in that it helps to prevent the aspiration of fluid during unconsciousness by the means of an inflatable cuff. Prepare the following materials before beginning the procedure: a disinfected and clean endotracheal tube of the appropriate size. Tubes with low-pressure cuffs are preferred to reduce the risk of overinflation and tracheal trauma. A technique for best judging the size of the tube you will need will be described later. Here is a list of recommended tube sizes for various cats and dogs. A laryngoscope with pediatric and adult size blades. The sedation or induction drugs. A 3 or 6 milliliter syringe to inflate the cuff or the endotracheal tube. A stylet or guide tube to stiffen small tubes during passage between laryngeal folds. A 12-inch tie gauze or length of IV tubing to secure the tube to the mouth. A dry 4x4 gauze. An ambu bag or anesthesia machine with an oxygen source. A stethoscope. A sterile water-soluble lubricant or lidocaine gel. Lidocaine spray for use in cats. Estimate the endotracheal tube size needed by palpating the cervical trachea, as shown here. Have several tubes of varying sizes available and inflate the cuffs to check for any leaks. Next, deflate the cuffs and lubricate to the end of the selected tube with a sterile lubricant or lidocaine gel. Once the patient has been properly sedated, place him or her in sternal recumbency. We will begin by discussing the procedure for two-person intubation. An animal and lateral or sternal recumbency will usually require 2 people to intubate. An assistant supports and extends the patient's head and neck, then opens the mouth with one hand by placing the finger and thumb behind the maxillary canine teeth. The assistant's other hand pulls the tongue forward and against the mandible using a 4x4 gauze. Care must be taken to avoid pulling the tongue down onto the canine teeth and puncturing the ventral aspect of the tongue. The assistant must also avoid placing pressure under the patient's neck and obstructing the view of the larynx. The technician should now gently insert the laryngoscope blade into the oral cavity. Hold the blade against the tongue and use the tip of the blade to open the epiglottis and expose the laryngeal folds as shown here. If a laryngoscope is not available, the tube can be used to depress the tongue and visualize the laryngeal folds. For single-person intubation, the patient is placed in dorsal recumbency with the head and neck extended forward. Dorsal recumbency positioning reduces excessive manipulation of the head and neck during intubation of the traumatized, critically ill, or unconscious patient. With your dominant hand, hold the tongue and laryngoscope handle, with the handle pointing up. Use the tip of the blade to open the epiglottis and expose the laryngeal folds. Once the cords are visible, insert the lubricated endotracheal tube through the cords and into the trachea until the cuff is at least 1 to 2 inches past the laryngeal folds. Cats can have significant laryngeal spasms that prevent passage through the laryngeal folds, in which case it may be necessary to spray a small amount of lidocaine onto the laryngeal folds. A stylet or guide tube placed into the endotracheal tube may also be used to gently assist passage of the small tube through the narrow passageway. Make sure there is at least 1 inch of stylet at the back end of the endotracheal tube to facilitate removal, and that the tip of the stylet is not exposed at the other end of the tube to prevent trauma to the laryngeal folds and trachea. Remove the stylet once the end of the endotracheal tube passes between the laryngeal folds. After the endotracheal tube has been placed, secure the tube with tie gauze or tubing behind the canine teeth and around the maxilla, mandible, or neck. Next, incrementally inflate the cuff with 1 to 5 cc's of air. With each incremental injection of air into the cuff, check for air leaks around the cuff by delivering a breath while listening and lightly smelling for gas at the mouth. Be sure to confirm that the chest inflates with each breath delivered. Using a stethoscope, auscultate both lung fields while squeezing the bag to confirm that breath sounds are heard bilaterally. If breath sounds are not heard or abdominal distension is observed, intubation of the esophagus and not the trachea is likely to have occurred. If the tube is not in, remove the tube. At this time, it is best to examine the laryngeal folds and make sure that the tube is in the trachea. Breath sounds heard on one side of the chest suggest that the endotracheal tube may be placed beyond the trachea into one of the two main bronchus. If this occurs, deflate the cuff and slowly retract the tube until breath sounds are ausculted on both sides of the chest, and then reinflate the cuff. Here are a few considerations to keep in mind when intubating animals. If a procedure is performed that requires significant flexing of the head and neck, there will be a risk of kinking and occluding the tube. Caution should be exercised during these procedures. Secondly, it is very important that you understand the proper operation of the anesthetic machine and the use of the pop-off valve prior to undertaking the intubation of an animal. Thirdly, once the tube is in place, it is important to maintain its position. Always make sure that the tubing or gauze used to tie the endotracheal tube in place is tight around the tube. Visualize how far the tube is in so that you can determine if it prematurely slips in or out. Whenever an animal is under anesthesia and intubated, it is important to use as many monitoring tools as possible. Monitoring a patient's oxygen levels, blood pressure, heart rate, capillary refill time, mucous membrane color, and other parameters will ensure that the animal is stable during intubation and anesthesia. You will want to periodically auscult the lungs to listen for breath sounds and for evidence of fluid in the lungs or pulmonary edema. You will also want to periodically auscult the heart to check the heart rate. An esophageal stethoscope is a very good way to listen to the heart and lungs. This special stethoscope passes down the esophagus to a point adjacent to the heart. In this position, monitoring the heart is quite readily accomplished. Next, we will discuss the proper removal of the endotracheal tube, often called extubating. Animals can reflux or vomit stomach contents while waking up from anesthesia. If there is any fluid accumulation prior to extubating, be sure to suction the oropharynx. Maintain a patient airway by keeping the endotracheal tube in place and the cuff inflated until the animal is breathing normally and has a normal gag reflex. Once the animal has a normal gag reflex and is breathing normally, deflate the cuff and gently slide the endotracheal tube out. Until the animal is fully conscious, it is a good idea to monitor for adequate breathing, mucous membrane color, capillary refill time, and signs that the patient might vomit. Keep a suction unit nearby and ready to clear the animal's upper airway in case they reflux stomach contents or vomit. For the animal that is critically ill or has neurologic, heart, or lung disease, keep an endotracheal tube, laryngoscope, and ambubag in the nearby vicinity in case rapid intubation is required. Once the patient has fully recovered, it is time to clean the endotracheal tubes. These tubes should be washed thoroughly with the appropriate disinfectant after each use. A small wire pipe cleaner can be used to clean the inside of the tube. Special racks to dry and store these tubes, like the one shown here, are available through most veterinary distributors. This section has introduced you to the fundamentals of intubating dogs and cats for surgical procedures. Like many of the other technical skills in this series, you must practice this technique to gain proficiency. If at any time you have a problem while intubating a patient or with maintaining intubation in a patient, contact the attending veterinarian or senior technician for help.